This large enveloped dsDNA virus is associated with 70% of the initial genital infections by this virus group. Clinically, these infections present with small erythematous papules which progress to open ulcerations. Infections can become latent and recurrent. Which virus is this? A. HIV-2. B. HIV-1. C. HSV-2. D. HSV-1. The answer is C. HSV-2. Herpes simplex type 1 and 2, HSV-1, HSV-2, are both large enveloped DNA viruses which cause latent and recurrent infections. However, HSV-1 is primarily associated with infections of the pharynx, skin, and central nervous system. On the other hand, HSV-2 is primarily associated with genital infections, representing approximately 70% of all such initial infections. HSV-2 infections recur more often as well. Which of the following viral pathogens is associated with genital diseases? A. Respiratory syncytial virus, influenza virus, parainfluenza virus. B. Rotavirus and Norwalk virus. C. Dengue fever virus and Lassa fever virus. D. Coxsackie virus type B and echoviruses. E. Human papillomaviruses and herpes simplex virus type 2. The answer is E. Human papillomaviruses and herpes simplex virus type 2. Genital tract infections by human papillomaviruses is considered a sexually transmitted disease. HPV type 6 and 11 are mostly implicated in genital warts that are found on the squamous epithelium of external genitalia and perianal areas. Intraepithelial neoplasia and carcinoma often result from genital tract infections caused by HPV type 16 and 18. Herpes simplex virus type 2 is a major cause of genital herpes, which is another sexually transmitted disease. Primary infection is accompanied by inguinal adenitis, fever, malaise, myalgia, and lesions on genital areas. Which of the following viral inclusions correspond with the pox virus? A. Owl's eye intranuclear basophilic inclusion body in cells of tissues or urine sediment. B. Cowdrey type A intranuclear inclusion body in single cells or in large syncytia. C. Paranuclear acidophilic inclusion body in the cytoplasm. D. Guarneri bodies in the cytoplasm of infected cells. E. Negri bodies, intracytoplasmic, in brain tissue. The answer is D. Guarneri bodies in the cytoplasm of infected cells. The inclusion bodies are the stainable structures found within the nucleus or cytoplasm of the host cell. Inclusion bodies result from the histological changes caused by the presence of viral components or the changes in the cell structure mediated by the infecting virus. The detection of the inclusion bodies by microscopic examination can be used for laboratory diagnosis of the viral infection, as they are characteristic for particular viral infections. Guarneri bodies are inclusion bodies, associated with infection with the pox virus. The scraping of cells from the lesion is stained and examined microscopically. Guarneri bodies appear as acidophilic inclusions in the cytoplasm of infected cells. Which of the following viral inclusions correspond with the herpes simplex virus? A. Owl's eye intranuclear basophilic inclusion body in cells of tissues or urine sediment. B. Cowdrey type A intranuclear inclusion body in single cells or in large syncytia. C. Guarneri bodies in the cytoplasm of infected cells. D. Paranuclear acidophilic inclusion body in the cytoplasm. E. Negri bodies, intracytoplasmic, in brain tissue. The answer is B. Cowdrey type A intranuclear inclusion body in single cells or in large syncytia. The inclusion bodies are the stainable structures found within the nucleus or cytoplasm of the host cell. Inclusion bodies result from the histological changes caused by the presence of viral components or the changes in the cell structure mediated by the infecting virus. The detection of the inclusion bodies by microscopic examination can be used for laboratory diagnosis of the viral infection, as they are characteristic for particular viral infections. Cowdrey type A inclusions are intranuclear inclusion bodies characteristic of infection with varicella zoster virus, VZV, or herpes simplex virus, HSV. These inclusions can be found in single cells or in large syncytia. Examination of the HSV-infected cells in tissues or smear reveals giant cells with characteristic intranuclear inclusions that are acidophilic and are known as Cowdrey type A inclusions. Cowdrey type A inclusions are also seen in skin lesions, respiratory specimens, or organ biopsies in the cytological examination of cells infected with VZV. Which of the following is true of human adenoviruses? A. They are enveloped viruses with helical nucleocapsid. B. Genome consists of a circular single-stranded RNA. C. Replication occurs in the cytoplasm. D. Forms acidophilic intracytoplasmic inclusions. E. Encodes for its own DNA polymerase. The answer is E. Encodes for its own DNA polymerase. Adenoviruses are non-enveloped viruses with an icosahedral nucleocapsid. The capsid contains 12 pentons at each vertices with 12 fibers projecting from the vertices. The genome is a linear double-stranded DNA with terminal protein. Viral attachment proteins are present in the fibers projecting from the vertices of the virions. The additional characteristics of adenovirus include the following: the virions replicate in the nucleus, encode proteins to promote mRNA and DNA synthesis, including its own DNA polymerase, infects epithelial cells lining respiratory and enteric organs. Virus can become latent in lymphoid tissue and can be reactivated by immunosuppression or infection with other agents. Forms basophilic intranuclear inclusions within an infected epithelial cell. Last, they are commonly associated with respiratory diseases, adenoviral pneumonia, epidemic keratoconjunctivitis, and pharyngoconjunctival fever. What is the viral agent associated with progressive multifocal leukoencephalopathy in immunocompromised patients? A. Herpes simplex virus. B. Parainfluenza 1. C. Coxsackie virus A. D. JC virus. E. Lassa fever virus. The answer is D. JC virus. JC virus is a papavirus associated with progressive multifocal leukoencephalopathy, PML, in immunocompromised patients, including AIDS. PML is a subacute demyelinating disease of the central nervous system, which is primarily seen as a complication of advanced disseminated malignant conditions, such as Hodgkin's disease or chronic lymphocytic leukemia. The patient presents with multiple neurological symptoms. The symptoms are not attributable to a single anatomical lesion. Clinical manifestations include impairment of vision, speech, and coordination that can lead to paralysis and death. Human immunodeficiency virus, or HIV, is an enveloped human retrovirus of the lentivirus family. There is also a significant number of HIV-infected individuals who never become sick, never experience a decline in their CD4 counts, and never develop high plasma loads of viral RNA. The reasons that these individuals never become sick include host factors such as the presence of mutations that provide resistance to HIV, such as which of the following mutations? A. CCR5. B. CXCR4. C. IL-8. D. MAC1. E. SDF1. The answer is A. CCR5. CCR5 is necessary for HIV entry into the host cell. CCR5 is expressed by macrophages, dendritic cells, and CD4 T cells. It is thought to be the major co-receptor for establishing primary infection, since individuals who are homozygous for a mutation in CCR5 appear to be resistant to infection by HIV. For example, the CCR5 delta 32 deletion mutation seems to confer resistance against HIV-1 by blocking its attachment to CCR5 so that HIV cannot gain entry to the cell. Development of drugs directed at chemokine receptors is thus an active area of research. Which group should not receive the flu virus annually? A. Pregnant women. B. Healthy adults older than 18 years old. C. The elderly. D. None of these groups should receive the flu virus annually. E. All of these groups should receive the flu virus annually. The answer is E. All of these groups should receive the flu virus annually. The flu virus can be either live attenuated or inactivated. The Center for Disease Control and Prevention, CDC, recommends giving the flu virus annually to healthy adults, pregnant women, and children older than 6 months of age. The virus is different from year to year, and the vaccine each year represents the most common active forms of the virus. Vaccination is a type of primary prevention. Which of the following is the correct sequence of viral replication? A. Penetration, attachment, protein synthesis, uncoating, assembly, and release. B. Attachment, penetration, uncoating, protein synthesis, assembly, and release. C. Penetration, uncoating, attachment, protein synthesis, assembly, and release. D. Attachment, uncoating, penetration, protein synthesis, assembly, and release. E. Uncoating, attachment, penetration, protein synthesis, assembly, and release. The answer is B. Attachment, penetration, uncoating, protein synthesis, assembly, and release. Viral replication takes place in several stages. Once the virus recognizes the target cell, it binds to the cell. The viral attachment protein present on the surface of virion interacts with the cell receptor. Following attachment, the virus can penetrate the cell by process of endocytosis or fusion. In the step of uncoating the capsid, the envelope is removed and viral nucleic acid is released inside the host cell, so the viral genes become available for transcription. What mold produces aflatoxin, a common contaminant in peanuts, peanut butter, pistachios, Brazil nuts, and corn products? A. Cladosporium. B. Aspergillus. C. Penicillium. D. Mucor. The answer is B. Aspergillus. Aspergillus flavus is a mold species commonly found in peanut butter and many other foods. It produces aflatoxin, a toxin linked to increased risk of liver cell cancer. The other mold species listed are not considered to be related to liver cancer. Cladosporium species are rarely harmful to humans. Penicillium species produce antibiotics, which we commonly use to treat infections. Mucor species cannot grow in warm temperatures, and are unable to infect humans, with the exception of certain heat-tolerant strains, which may cause some zygomycosis.